Good morning, Fayetteville. This is Fricative Franny with SLP Action News. Today on your Thursday morning hot take, we are covering a frequently misunderstood disorder that affects over 1 million Americans, aphasia. Aphasia means without language, and it most typically occurs after a stroke. Aphasia can affect listening, speaking, reading, writing, and various language functions. Now that we've learned a little about aphasia, we'll take it over to Sally Schwa, our ears on the street. How are you doing, Sally?
You betcha, Franny. I'm here today at the Discourse Rehabilitation Center. I just spoke with their resident SLP, Leslie Chatter. Miss Chatter informed me that aphasia can be quickly identified with an MRI or CT scan, but as a speech-language pathologist, she can complete a comprehensive language assessment to confirm the presence of aphasia and determine the appropriate course of treatment. The prognosis for this disorder has much to do with the recovery from the stroke that led to the aphasia diagnosis. Most individuals experience some type of spontaneous recovery, which is a natural restorative process. With speech therapy, clients can recover all or some language function, as well as learn ways to compensate for persistent language deficits. Back to you, Franny.
Thanks, Sally. Now we're going to take it over to Dr. Speech-a-Lot to get a better understanding of the science behind this disorder.
Thank you, Franny. I will start by pointing out that aphasia is an acquired communication disorder that affects a person's language function. It is not a disorder that affects their IQ at all. There are 7 different types of aphasia. We have fluent aphasias and non-fluent aphasias. The fluent aphasias are Wernicke's, anomic, conduction, and transcortical sensory. The non-fluent aphasias are Broca's aphasia, global, and transcortical motor. A person with fluent aphasia has a lesion or brain damage in their temporal lobe, and a person with non-fluent aphasia has a lesion in their frontal lobe. The lesions in these different parts of the brain cause different deficits. So we're going to get into those a little bit. Fluent aphasias, they struggle with receptive language comprehension. So all the information that's coming at them, they just can't make sense of it. But they do continue to speak. They have a regular stress pattern, intonation pattern. If you didn't hear the content of their speech, you could mistake it for normal speech. Non-fluent aphasias have struggle with expressive language, which just means that they have slow, labored speech, and they have trouble retrieving words and forming sentences. A speech professional's role in treating aphasia begins with aiding in the recovery of language. Where there continues to be persistent language difficulties, a speech professional can provide strategies to compensate for deficits and maximize on the client's ability to communicate. I hope this information can give friends and families of those living with aphasia an idea of what's going on with their loved ones. Those with aphasia have a fully intact IQ. Having patience with their communication disorder can go a long way.
A big thanks to Dr. Speech-a-Lot and Sally Schwa for highlighting such an important topic this week. For additional information on aphasia, you can check out the National Aphasia Association at aphasia.org. Now we're going to take it over to Gary with weather.